Dr. Avinash Bhosle sir, Dr. Samir Soni sir, and welcome all the state president and secretaries and all the city branches president and secretaries. It is an honor for ISA Borivali to host this meeting. Recently, in last 4 5 months, we heard a lot of cases. We had discussion of lot of cases where our city branch wanted to know how ISA can help us. Also, we wanted to know what is the practice in another state and another cities. What is the role of ISA and how the private practitioners are being taken care of. So, we requested our national Dr. Naveen Malhotra sir to give us a practical view of how ISA is helping us. Over to you, Naveen Malhotra sir. Before that, Dr. Manisha Katikar madam, would you like to say a few words?
Respected Dr. Venkatgiri sir, ISA National President, Dr. Anjali Hure Madam, Vice President ISA National, Dr. Naveen Malhotra sir, Honorary Secretary ISA National, and all the city and state branch president and secretaries. I'm seeing so many of my good friends all over India who have logged in for this webinar. It is always pleasure to join ISA Borivali activities, and it is always pleasure to listen to Dr. Naveen Malhotra sir, the hardworking Secretary of ISA National. Welcome you all, sir. And with this short introduction, I think Shilpa, we should proceed for the program. Thank you so much.
Over to you, sir.
I think Dr. Venkatgiri has also logged in. Dr. Giri, am I audible?
Yes, sir.
Okay, fine.
Yes, sir, you are audible. Please continue, sir.
I hope my audio and slides are visible. Somebody to please confirm.
Yes, sir. Yes,
Yes, sir.
just
Okay.
it's moving also.
Right. So I shall be muting all, and then we can interact as and when you wish to. I bring with myself meeting from Indian Society of Anesthesiologists National Headquarters, and ISA Borivali City branch has given me this very interesting topic, which I am also finding it very useful in discussing with you all the building blocks for ISA City branch. I, Dr. Naveen Malhotra, your own secretary, will be interacting with you for around 40-45 minutes or so, and then we can have good interactions as question answer sessions also, one-to-one and honest one. The ISA state and city branches are the backbone of ISA. We are 200 plus branches and around 29 state branches and 172 city branches. For ISA national, the city, state and metro branches are the backbone. We have been following the concept of Team ISA. The Team ISA at the national level, ably supported by state branches and the city branches. We firmly believe the truth that teamwork is at the heart of great achievements. So we firmly believe in teamwork between the different city branches, state branches, and the national body together. And we follow this principle that success is best when it is shared. So each and everything which is being done at the national level is immediately shared with the state branches and the city branches. And we work in a very, very transparent and quick communications with our branches, branch office bearers and general members. For any branch, the important thing is leadership, the office bearers and the team ISA of that city branch. A leader is one who knows the way, goes the way and shows the way. The president is just like a guide or patron to society, like Dr. Yogin Bhatt of Borivali branch. I would have been happy if you would have been listening this, my emotions for him. I believe that he's a man with clear thinking and appropriate actions. The key to successful leadership is influence, not authority. We should be able to influence our office bearers, our colleagues by our actions by our thoughts. Secretary of any branch, may it be city, state, or national, he is the custodian of that branch. By virtue of the constitution, he has to take care of that whole body. He or she is the heart and soul of any branch. Dr. Shilpa, I have seen her. She has been working day and night for Borivali. This webinar was rescheduled. She was even ready to do her on her birthday. So I told Madam, please, on that day you should be with your husband and your son. And another date she fixed. Next day was board exam of her kid. So she said, nahi sir, karte hain. So I told her clearly, no, Dr. Shilpa, we will do at a time which is convenient to you also, and lots of webinars can be done. So she firmly believes that work hard in silence, let your success be your noise. And I'm very sure that her success is making a lot of noise. As far as Borivali is concerned, when we were kids, we used to see this ad in ZTV. SL World jaunga main, ghar nahi aunga main. So we had this about the image of Borivali whenever we used to think about Maharashtra and especially the part of Borivali, the SL World, the water kingdom. Another important component of any branch is its membership, because the membership and the members, they share the vision, skills, and form the aims and objectives, goals, and achieve the success together. And I can say that Borivali is a very active branch, rather super active branch. They are very actively involved in updations, shifting of members to the ISA Borivali branch, and they tag the members and branches to that they are now not in Navi Mumbai or they're now in Mumbai Metro, and immediately Shilpa and her team gets in touch with the national headquarters and they shift the members to the Borivali branch. And I can tell you they have learned a lot from COVID pandemic. They have done man-to-man marking. They know each and every member who is living in Borivali but not a member of Borivali officially, or her email has to be updated. They are typically behaving like a COVID pandemic specialist. Trace, track, and treat. They are tracing each member, tracking and treating whatever the deficiency is there, whether in mobile number, whether it is in branch address or office address. They get in touch immediately with the national headquarters and get it rectified. Another important aspect of any branch, in addition to the office bearers, the team members, is having their own office and doing regular meetings. Each branch should have its own office. We have been fortunate enough that in Platinum Jubilee, we were able to inaugurate our registered office at Chennai recently. Cochin, Nasik, Nagpur, Jabalpur, Patna, Delhi, they have their own offices, and UP is soon going to have its UP house. And the advantage of having this office and doing meetings is, initially we will fight. Whenever the first few meetings will be there, there will be fighting, but second, third, fourth meeting, it will convert to argument, and then subsequently to agreement, and then everyone will prosper together. This is a natural course of any city branch across the country. But whenever we meet and discuss, we definitely prosper together. We should meet preferably at least once in a month. We should do clinical meetings, discuss the practical problems, maybe whether it is the departmental one or the practitioner's one. Discuss the challenging cases. The nuisance mongers in the branch. Everybody is not very cooperative. Some people may be charging less also. Some members may be creating some other problems. We can discuss that. Remuneration issues. All these issues can be discussed and talked when you have an office and you do meetings regularly. Then when you hand over, it is equally important to choose your successor wisely. It has been rightly said that leaders don't create followers, they create more leaders. So the legacy has to continue. Whosoever is in the office should think that what after me? There is no success without a successor. Even if you are successful, you have to choose your successor very, very wisely. As has been rightly said, a politician thinks of the next election. A statesman thinks of the next generation. So you, the city branch office bearers, they have to act like a statesman, the state branch office bearers, and ensure that the continuity is maintained and the good work done is continued for years and years together. Dr. Shilpa and Dr. Yugin Bhatt made my job easier by posing certain questions. Okay, sir, you please discuss these questions first, then we will put more questions to you. The first question which they asked me to discuss was adverse event, and the most common adverse event for anesthesiologist is death of the patient either on the table or in the post-operative period. And it is very, very disturbing. It is disturbing emotionally and it is physically draining. You feel why it has happened to me, why I have lost a patient. And everything, you just feel that you are empty from within. In such a scenarios, please call your friend or a colleague you can trust, because 1 + 1 is 11. But yes, you should call the one who does not question why you have done this case, why this technique was done, why this drug was not given. And even this is important for the city branch office bearers also, who are called in such a scenario, that please put confidence. And if you say words of solace like that, it can happen in the best of the hands also. So call your friend who is just like Karan. Karan had committed to Duryodhan that whatever might be, I will not leave your friendship and I will be your friend till my death. So in such scenarios also, you should have 1 or 2 friends like that, or even if you are not a friend to the member who has asked for help, please behave like Karan. Karan, I am referring to Mahabharata. Second important thing is proper notes. It is a dictum that if it is not written, it was never done. Your note should show that a reasonable level of care was given for the procedure, that means the anesthetic procedure, and the complication which occurred. I repeat, reasonable level of care, whether it is in the form of proper PSC notes, jotting down the investigations, the consent form, the anesthesia record sheet, post-operative notes, and if you've taken a second opinion or a referral, everything should be documented very, very properly. If you are emotionally drained, you can take a help of your colleague who is senior or a person who is in medical college, that what proper notes should be taken. One should always put proper notes. And as a ready reference, there are ISA endorsed forms in the on the isaweb.in. You can always download them in the form of consent, anesthesia record sheet, PSC, and other forms. They are all available on our ISA website under the PPF guidelines. Then, if such a scenario occurs, you have to manage the attendants also, you have to manage the police also, and you have to manage the politicians also. But one thing should be there in your voice, in your actions, that you should be compassionate. At the same time, be confident, be careful, no loose talks, be considerate. The attendants and everybody should feel that yes, you are also equally disturbed that a life has been lost. At the same time, use all your skills, contacts, and knowledge of law to protect yourself. That is very, very important. I'll quote some examples. If DOT occurs, how to manage a surgeon. At times, it was a surgical complication. Then you have to be very, very clear, though soft but firm, that this is a surgical complication, nothing related to anesthesia. However, if it is an anesthetic complication, you should manage your OT staff, the sweepers, the bearers, the ward boys. They may come in outside the OT and may give some wrong details to the attendants. Just keep a watch on them. You have to manage the attendants also. Keep them posted about the event which has occurred. If possible, if you think it's appropriate, show him that, okay, cardiac arrest has occurred and resuscitation is going on. Patient has been revived and is being shifted to ICU. Also, at times, you will receive police summons. Police will come to the hospital also, or after the case, you receive police summons. So you should know in the law that you cannot be called by police for a statement. It has to be through a board. Whenever there is a criminal complaint lodged against a doctor, it goes to the chief medical officer or civil surgeon of that district, who constitutes a board, usually of, so suppose it's an obstetric patient, a surgeon, an obstetrician, anesthesiologist, and one more. And they give the report whether on the basis of records available, there is negligence or not. Then only criminal case can be filed. But at times, to satisfy the attendants with political pressure, they will say, okay, doctor, please come to the police station. You can keep sitting there and have a cup of tea. You should not be worried about that. Even the ISC office bearers, they should have those guts to visit the police stations. They should not be shy. You are all class 1 officers, much above the SHO and other things, equivalent to SP of that district. So you should be confident in dealing. Okay, even local IMA branch also comes in place, and you should not be shy of visiting the police stations or afraid of visiting the police station. And at times, the patient is from your own social circle. So use your social circle influence. And suppose an untoward incident has occurred, manage the people of your own community in that social circle who can say good words about you. So these all are the scenarios which you and me come across daily as an office bearer, as a clinician, as an administrator, and we have to manage all these aspects, whether it is a clinical management of the patient, clinical management of the complication, as well as administrative management of the surgeons, OT staff, attendants, police, politicians, social circles, press and media, each and everything you have to take care. You have to have a good cup of tea with lots of sugar into it and pray to God and face the problem which has occurred, because at the end of the day, you have never wanted that this complication should occur to your patient. It has occurred inadvertently. You have tried your best, but still the loss has occurred. But you have to, at the end of the day, manage it. And this management becomes easier if the city branch office bearers are hand in hand with you. They support you morally also and legally also. And no loose talks from the other colleagues. Because he used to do this thing and now this complication has occurred. No loose talks by the your own colleagues. This can happen to best of the clinicians. And on the medical boards, people who are administrators or nominated from IMA or from the medical colleges, you should be very, very thorough in interacting with the records. And usually on the records are available. And the term which is used is on the basis of records available, there appears to be no medical negligence. And if you are not going for the board, yourself are not going for the board because of your preoccupation, you are sending your departmental juniors or your colleagues, guide them how to interpret the records and how to be slightly favorable to your own colleague. At the same time, you should have a professional indemnity cover. No anesthesiologist should have a professional indemnity cover less than 1 lakh, 1 crore. And there are a senior doctor panel and a senior lawyer panel also in that professional indemnity. Senior doctor panel in the ISA endorsed professional indemnity insurance scheme. You can choose your own panel of doctors. You can create your own panel of doctors. Suppose in Thane, Borivali, Mumbai, you can have your own doctors. So these are the senior doctors. Their payment is done by the insurance company. And you can have your own lawyers also. Okay, these are our lawyers whom we have faith in, and they will protect you. Also in Maharashtra, there is local city branch endorsed professional indemnity schemes also. So these are all having this protection. You should always have a professional indemnity insurance scheme. Then questions may be asked to ISA branches also, office bearers also, whether it is city, state or national. And they usually come to us as a national body. Okay, what is, rather we issue statement to whomsoever it may concern that in this particular case, on the basis of records available, these are the facts. And suppose a judgment has gone against the anesthesiologist, we try to we defend our colleague with the best possible intention, with the best possible legal language on the basis of records available. And this is done regularly. There are numerous instances during my tenure, whether in almost all parts of the country where we have done this, whether there have been some, even at the time of the giving of the notice or when the case is going on, even after the judgment has come or the conviction has come, we have supported our members, made the central zone, south zone, north zone, west zone, anywhere we are definitely with our colleagues, with our members. Another question which is commonly asked is whether the guidelines given by ISA, they are valid in court of law. I have seen numerous instances where the opposite counsel has quoted ISA guidelines and said that these are your national body guidelines and you have not followed these guidelines. These guidelines of ISA, they are available on ISA website. The opposite counsel downloads those guidelines and sees whether you have followed these guidelines or not. So that means they are valid and 200% valid in court of law. Because as a national body, we are the largest body of India representing the legal, social, academic, clinical, research welfare of our members. So whether they are the consent, record keeping, monitoring standards, fasting and feeding guidelines or pre-operative investigation, they are all valid statements. If you don't quote in court of law, the opposite counsel will definitely quote in court of law if you have not followed these guidelines. So whenever these guidelines are followed, we screen it 10 times, okay, whether our members will follow it or not, will be able to follow it or not. Next question which was given to me was managing the stress. Does ISA has something in mechanism for managing the stress level, the psychological stress, depression, suicidal tendencies, substance abuse? The stress has to be managed by the mentors, and mentors can be, they are there at city level and at state level also and at national level also. We had tried to work out an helpline number or a panel of doctors who have got good communication skills, maybe psychologist or psychiatrist, maybe anesthesiologist having this bent of mind. But the issue which we found was that this is a job which is required 24 hours availability. Somebody may be having a severe stress at 2 a.m. So we are working over it, how to maybe having rotatory things, rotatory duties. Still, for this, we need volunteers. Payment is no issue, but sparing your valuable time. I can only commit that Naveen Malhotra is available 24/7. Yesterday also, member called me at 2 a.m. He had some problem. Okay, fine. I'm there to help you. But others have to volunteer. I need volunteers who can help in managing the stress as well as clinical problems. Maybe they can give, okay, I'm available every Monday or I'm available for 1 week, this particular week. So these type of things we are looking forward to it. But definitely we are teaching work-life balance, the financial security, having a second source of legal income. This is very, very strongly promoted amongst our members nowadays. Please have second source of legal income. Do meditation, do yoga. Next question which was asked me, what is we doing to attract the young anesthesiologist? And the answer is YUA ISA. This program was one of the programs started by me during my tenure as secretary with the able support of our governing council and team members. But since I was passionate with and for my strong love for the youngsters, I've been looking after this program. And I'm very happy to share with you that it has been established now, both at national level and it is growing at state levels. We are planning to have soon we will be having a debate on a very important clinical topic. I can share with the topic also, repeat spinal after a failed spinal. So this debate, interstate debate, will be conducting very, very shortly. And this UISA we are promoting whichever age 40 years or less, or who are within 10 years of post-graduation, whether they are PGs, SRs, consultants, and private practitioners. And for them, we are having very, very successful ISA online PG classes, which are held every Monday. We are soon starting ISA skill centers. ISA Neon Inland and International Fellowships are going on since many years. ISA online PG quiz was started last year. These are all activities, PG quiz, PG classes, skill 10 centers. These are all for young anesthesiologists only. And soon we are going to have our second national Yuva ISACon 2022 at Haryana. It will be for the Yuva, by the Yuva, of the Yuva. We've started numerous awards. Dr. B.B. Mishra Young Anesthesiologist Award, Dr. M.T. Bhatia Young Pain Physician Award, ISA Trini Talent Award. These are all for young anesthesiologists. In addition to the best poster and best paper awards of the Ludhiana, as well as Dr. T. N. Jha Memorial and Dr. K.P. Chansoria Medal Award. And during this Yuva ISA activities, the young anesthesiologists, they interact with the seniors, because seniors are the chairpersons, and they learn from them. They learn from their wisdom, from their experience. And such an activity is now coming at the state level also. Maharashtra is soon going to hold its second Mahayuvacon in July. Delhi is going to hold its first Yuvacon sometimes around 2 to 3 months from now. So these all activities are going across the country, and because they are our future. We have to build them, nurture them. Another question which was posed to me was actions and interventions of ISA. If anesthesiologist does any case without proper anesthesia machine, without appropriate investigation, without proper fasting guidelines, what next? I firmly believe in this principle, and I think if you all follow this, 90% of the problems will be solved. Talk to the member, call telephonically, and invite him over a cup of tea. There is no benefit of WhatsApp chats and debates. You can keep on typing. I don't know why people can type for hours and hours together on WhatsApp rather than discuss telephonically for 5 to 6 minutes. Because a lot of problems in the world would disappear if we talk to each other instead of talking about each other. So please talk to that member. Tell him, boss, madam, it has to be done in this way. Be firm, but be soft. 90% of the members will say, "Hame to pata hi nahi tha. We never knew. Now we are going to do." Especially for the new members who join your branch. Welcome him as a new member in the family, rather than seeing him as another threat of your financial insecurity or a threat to your day-to-day routine work. Still, if he does not agree, leave him or her alone. One day, God forbidding, he will land in, if he lands in crisis, at that day support him. Don't leave him alone at that time. Then he will realize for his life and motivate others to follow the guidelines which others are following. If a surgeon, you take him out of the crisis now, then he will never question you why you have asked for this investigation or why you have asked for that optimization. Because he knows that if he can pull you out of the woods, if he can manage your complications, the surgeon's complications, then he can manage his own work also. Same way, when that member who is not following ISA guidelines, if he or she is in problem, at that time do support him. Don't leave him alone at that time. Then he will realize that these are good people, they are talking nice things. He will follow and ensure that others also follow the guidelines. Dr. Shilpa and Dr. Yogen Bhatt gave me another question. Can a fitness program include some exercises between cases and keeping its record? So this just surprised me, because we have got a very active Fit Anesthesiologist campaign going on, where we focus on physical, mental, spiritual health, as well as avoiding substance abuse and suicidal tendencies. And this is a ISA Fitness at Workplace video, which was launched on 16th October 2020 during COVID pandemic, right? So my request is this video is available on ISA Fit and Astrologist campaign tab of ISA website and see this video. It's we have trimmed it, not very long one. It teaches you exercises which can be done in the OT because we all work in the OT from morning to evening. There is if we do our vitamin D levels, everybody will have low vitamin D levels, and this is a good tool where you can exercise in between the cases in the OT itself and keep yourself fit, especially for females. Both boys and girls should do it, but this is a very, very good video. And also we have published a special article, Breaking Barriers to Remain Healthy and Fit During the Residency in Anesthesiology. I am one of the co-authors of this, and Dr. Swati Chabda, Dr. Suminderjit Singh Bajwa, Sanjay Chaube, Dr. Shibu Shashidharan, and Niru Sani are the other authors. And please go through this article. This is in IJA, and it has come up in the February 2022 issue. Just go through it, and you will enjoy reading it. How to remain healthy and fit while you are doing a residency in anesthesiology. This can be applicable to other senior colleagues also. Next question which was given to me was, can we have a medical legal experts on the ISA panel? Like if decreased vision after ISA, what next? PDPS not settling with anything. Patient refusing epidural blood patch, then what? Decreased sensory recovery after spinal original, what we can do next? So these are all clinical complications which are occurring after anesthesia. We're not leading on to DOT, but some simple things. Yes, these are managed right now. Practical thing is they are managed at local levels. Members definitely consult their seniors and teachers who have taught them. Maybe your teachers in medical colleges or your seniors who have taught them, whom you have confidence in, and with whom you can disclose your loopholes also. Okay, sir, I have given this drug extra, or I had hit the needle to the nerve. So yes, we can do it at a national level, provided members are ready to give time. As I was just talking about the two things, the psychology and counseling thing, as well as this is the medical helpline. We don't want to give it on Facebook or ISA website. Better one-to-one interaction so that members also feel confident that their things are kept secret. Other important activities which definitely has to be done and continued done is public awareness about anesthesiologists. We have got our public awareness flyer on Know Your Anesthesiologist and Know About Anesthesia. It's available on ISA website. We are lots of branches have got public awareness video. Soon we shall be releasing our ISA national public awareness video during the Platinum Jubilee celebrations. But the most important thing is post-operative visits. PAC is important, but post-operative visit is more important. If you visit the patient post-operatively and relieve the patient of pain, he will remember you throughout his life. He will remember your name, that this doctor came to me and relieved me of my pain. Because during anesthesia, in the OT, patients are worried, they're tense, they don't remember. But please, if you want single shot, sure shot thing, is post-operative visits. These are the public awareness flyer, Know Your Anesthesiologist. You can convert it into your own local language and you can put it in your nursing home, in your PSC clinics, wherever you go, just staple it. And this is a concise one from ISA National. And this is about Know About Anesthesia. I shall be taking up, I know there are some questions coming up chat box, but I shall be taking on the questions which have been put to me, and the clarifications and doubts on that also. And more questions are most welcome. One thing I can commit that I'll try to give honest and straightforward replies. I summarize, the team ISA is working on this particular principle, that coming together is the beginning, staying together is progress, and working together is success. A true character is developed only when a man crosses thousands of hurdles. So your branch will be successful, but you may have hurdles. Try to overcome them. I firmly believe in the three mantras: honesty, sincerity, and hard work. I conclude by saying the future belongs to those who believe in the beauty of their dreams. So believe in your dreams, follow them. God is there to fulfill your dreams, but the only requirement is that your intention should be good. If your intent is good, then the results will definitely be good. This was Naveen Malhotra, your own secretary, talking about building blocks for ISA City branch. Thank you very much.
Thank you, Dr. Naveen Malhotra, sir. You have covered each and every question, what we had in our mind. At this juncture, I see that many state president and secretaries have joined. Many city branch president and secretaries have joined. First, I would like our president, Dr. Yogen Bhatt, sir, to say a few words, and national president, and Dr. Venkat Giri, sir, to say a few words. Then we will welcome all the state president and secretaries and city president and secretaries and move forward for the question. Over to you, Dr. Yogen Bhatt, sir. Dr. Yogen Bhatt, sir, are you able to hear? Bhatt, sir? No, okay. Dr. Venkat Giri, sir, can you say a few words?
Yes, thank you, ISA Borivali and ISA Maharashtra. It was a good talk by Naveen, as usual. Because what is required is a member should know what ISA gives for them. Many people do not know that. Many things we are there, rule book and other things are in the website. Our reading habits have come down when the mobiles and WhatsApp have become more. Because even if after telling that, people don't remember what is required. So these are the basic things what members should know, that what ISA doing, what are the things, what is the ISA activities, how it is done. But in spite of telling, to be effective, we should practice. Well, last time we had, you may be remembering, all city and state branch presidents, we called a meeting, vice president called, what is ISA, what is the rules, bylaws, we told. Still after that, I'm very unhappy that, see, what is said is ISA member gets a 50% concession in the registration fee. We are not giving more to others. In spite of that, I am seeing the brochures giving that 1,000 rupees more for the others. Members getting 3,500, others getting 4,000. That's absolutely wrong. If he is getting 4,000, the member is eligible to get his registration 2,000 rupees. A member, if he demands, you are charging only 4,000 to him, I should be given a 2,000, that is right. That's what you have to see. After hearing this, unless you practice, first from the leaders, next for others, we have to practice. These are, I was telling, from the day of my secretaryship, even at the end of my presidentship, I am not able to correct. Unless we correct ourselves, there is no point in doing that. Please hear what is required, what he has told, and many, many things he has told what I is doing. And you have to practice in both spirit and words. We have to do that. That's my advice. I'm not telling most of the things. If you see the brochures, I get all the brochures. So they send the brochures. I send them a comment back that this is wrong. You have to do like this. But still, they say okay and all, but they want to please. I don't know whom you people, president, secretaries want to please, and at least you have to please our members. It is for our member society. Please do this thing. That's it. Anyway, Naveen, again, I think Naveen also will tell this thing with all the thing. I'm telling Naveen and sending the copies to him, telling that this thing. And he has given excellent talk. And please hear him again and do this thing. Thank you. All the best. Once again, missing you again, but and all city state presidents, Maharashtra and all over India. Okay. All the best. Once again, please, this may be available in YouTube. Please go and see it again and again. Thank you.
Thank you, Dr. Giri, for such nice words. Dr. Yogen Bhatt was logging in through car. I think he was driving, and we will have him soon. And yes, I echo. This is a very small thing. I actually we should overcome these technical things quickly. COVID has taught us to be very, very flexible. And if members have to be charged 50% less, you just put it in there. We should not discuss it further even. Just 2,000, 4,000, simple. 4,000 for non-members, 2,000 for members. Simple thing. So I think we have to overcome these technical things. If it has to be done, it has to be done. But I'm very happy that lots and lots of state office bearers have joined, and I'm open to discussions. And if Shilpa, you can pose me the questions which were there in the chat box, or I can just answer to them also. I will just go, or somebody can ask those questions to me, or
Yeah.
unmuted,
Yes.
you can ask the questions directly.
Can
Our
I-
past
can I
GC
take my
member,
chance?
Aravinda is there. Aravinda is asking, past GC member is there. Maybe I don't know whether he's from India or he's from US today. Last time when we were there, he was not.
Okay. I think ladies first, Dr. Aravinda Ray, Vice President, Madam wants to say something. And then you can unmute yourself. Dr. Anjali Bure, please.
Yeah, thank you, Dr. Naveen. Good evening, sir. Your advice is well taken, Giri sir. And Dr. Naveen, truly inspiring. One of my favorite lines for Dr. Naveen is that he breathes ISA. So sailing through different aspects of ISA was really par excellence today. And Dr. Naveen, I would like to ask you one question that these young budding secretaries wants to know today how to rise high in ISA by attending conferences all over or by calling different faculties to your city. What is your opinion?
Stick to basics. I can tell you, I am from state of Haryana and city of Rohtak. Stick to basics, serve your members. Serve, if you are a secretary of your city, be with them day and night, 24/7. Whether then you work at state level, then also be with all your city branches. I can only say, whether you attend conferences or not, whether you call faculties or not, whether you call president or secretary or not, my mantra is hard work, honesty, and sincerity. Whatever job has been given to you, just do that with good intent, and you will keep on rising from city to state, state to national. That is my mantra, madam. So yes, in the way you will be inviting, definitely you feel good that calling a national dignitary to your own city level adds to the adds to your own event. Secretary traveling, but it adds to your own event also if national dignitaries come. So that is also one of the things also. But whatever job is there, build your branch. Ensure that all the members are members, all the anesthesiologists are members of ISA. You meet regularly, and whatever all the things I have discussed during this talk, you should do that at city level. And then you can also become national secretary one day.
Thank you, Naveen. Can I have one more, please? In smaller cities, members are not ready to become ISA members. So should they be allowed for the academic meets? And in any city, if non-ISA organizations are running parallel, what should be our stand?
See, attending academics by anesthesiologists, most welcome. At the end of the day, we are an academic body, and if somebody is not a member, but he or she comes and attends the academic meeting of ISA, most welcome. We have already clarified, if it is a charged one, you charge them 2 rupees instead of 1 rupee. And if it is free one, they will come attend and become attracted towards ISA. It is the duty and conviction of the local office bearers to ensure and motivate the others to become members of ISA. They have to explain. I firmly believe that Amitabh Bachchan sells Navratan Tel, Thanda Thanda Cool Cool. So why can't we sell ISA to our members? Absolutely no issue. We are no less than Amitabh Bachchan. We can also sell as ISA to our members and ensure that they will become members of ISA. And so many good things are being done. Whatever is their interest, that has been taken care. Whether it is academics, whether it is research, whether it is clinics, whether it is art and literary, sports, fitness, cultural, you name anything and you have it in ISA. And membership is just 8,500. We change our mobile phones. Minimum cost is 25,000, and Apple 13 cost, X cost 75,000 every 2 years. 8,500 for life membership, nothing. You get so many things complimentary. Today only, I was interacting in my PNOT with my first year PG, those who have joined 2 months ago. So, you tell me, what do you think of ISA? Why will you join ISA? So he gave me 6 answers. Sir, I have to present paper for my MD. So I have to become a member, then only I can present paper. I have to present a poster also. I can take benefit of fellowship exam also of ISA. I can attend conference at the debated rate. Then the SR told, okay, once I become the member of branch, the private and corporate hospitals started calling me. He told that once she became members, they had the list of those anesthesiologists. I started receiving calls for employment. So your sort of birth certificate is made, and this data definitely, suppose you are a member of Faridabad city branch, she was from Faridabad, and Dr. Neha Sinha, she said, as soon as I became member of Faridabad's branch, I started receiving calls from Apollo, Metro, Fortis. Okay, you can join in as a senior resident there. So this also, all this helps. Number two, if other branches are there or other sister associations are there, there are so many. I firmly believe that we have to make our line bigger. ISA line is bigger and we are making it bigger day by day. And our successor will also make it bigger day by day. So we don't believe in rubbing others' line. If other sister associations are doing, they're all our friends only, our colleagues only, who are in different associations. Once amongst us are in different associations. Somebody may be in the Rotary, somebody will be in the regional, somebody will be in the pain, somebody will be in the research. Any sister association, if you are there, please keep on doing your work. We are doing our work and we are making our line bigger day by day. And we want to, if you are attracted towards us, then please do join us. And if you are not attracted towards us, then we will make you and we will do something to attract you towards us.
Very encouraging, Dr. Naveen. Thanks a lot.
Yes, Madam has given me a compliment. I breathe. Yes, I inspire, I and I expire. Yes, no doubt about that. Thank you, Madam.
Thank you, madam.
Thank you,
sir. At this juncture, can I welcome few president and secretaries who have joined us of the state. With your permission, sir, we have Dr. M. Veersham, President of Telangana. We have Dr. Dinesh Singh, President of Bihar, Jharkhand. We have Dr. Tanveer Singh, Punjab Secretary. We have Dr. Jyotirmay Chandrakar, Secretary of Chhattisgarh. We have Dr. Jyoti Patmia, President of Himachal Pradesh. And we have Shamshad Begum, President of Kerala. This is just by a message and phone call. We have all the president and secretaries who have joined. I'm sorry if I missed someone. We also have our GC member, Dr. Neelam Nalge, our President-elect, Dr. Hanuman Sale sir, and our own Dr. Pankaj Gupta sir who have joined. We have the city presidents, Dr. Sachin sir, Dr. Manisha Ghosh sir, and Dr. Sujata Zine madam who has joined. Can we move further for questions from Dr. Joy Shankar Jana sir? I'm so sorry.
No problem, no problem. Honorary dignitaries of ISA National, city branch and state branch presidents and secretaries, and city branch president secretaries. Fantastic talk by Naveen, as usual. I've been hearing Naveen for so many years, always to the point, brief and very crisp. Points taken from the chat box is that how to deal with the police and politicians' problems who pressurizes the doctor. That is the first question. How to avoid court matters, the second question. And question, private practitioners in the city do not take up membership. And third is that, last is that how to add records later. Suppose there's a problem and you want to add some more records in your notes. So how to add those? So these are a few questions. And one more question from my side is that, or rather from Shilpa's side, is that the participation of members in the activities of ISA has been going down day by day, especially during Corona times and even after Corona times. In spite of having academic activities, in spite of having all the other activities, fitness and all, how to improve the participation of honorary members in the city branch activities. This has been a very common problem and very common question asked by all secretaries and presidents. How to include all the members in various activities. I mean, you have the encouragement and you have the enthusiasm to invite people, come for this activity, and at the end, there is hardly any few people attending. So these are the various things. So there are about 4 or 5 questions. Naveen, if you want, I can repeat it again. You can go on answering. So
I'll try to remember.
Yeah, I'll repeat if you want.
See, as far as managing politicians and police,
Yeah.
you have to be very intelligent enough to know your powers also, your rights also, and you should use your political connections also. Police, as I have told you, they will say, "Doctor Thane mein aa jao. Please come to the police station." So you should, first of all, you should not be afraid of going to the police stations, and how to do, no need to panic. I know if you've not gone to the police station earlier, then bade badon ki pen dheeli ho jati hai.
Yeah.
But you have to go there, and what you can do is, suppose your friend is in trouble and then you go to the police station and help your friend out. That will help you out in day out. Whenever there's any problem, so you have to go and help your friends. You cannot keep on sitting in your AC drawing room and just guiding on phone. And politicians also, you have got your own connections. You treat them, you treat their patients also. Day in and day you are there taking their help, and you should have that image. Yes, I have done my best. Some wrong has been done to the patient, which was inadvertent, but still that complication has occurred, and we have tried our best. And this can happen in the best of the hands. But however, if this complication would have occurred in US, UK, or Mumbai, same care would have been taken. So we have taken the best, but we are next to God. We are not God. So you have to be active, and in that your other team members alone, you can be taken to task. They can take advantage of your emotional turmoil at that time. So better go with your colleagues, with your association members. Yes, here we can have our, suppose your city president is not your good friend, or you not having good friends, so he may try to utilize this occasion. So there comes the character of the office bearers, that you have to rise above the occasion and help your member who is in trouble. So that is the thing you have to take care. And also, once IMA is active in such scenarios, they give a call, then you should go to the your other colleagues also, whether it is of the ENT or onco or cardiac. You have to go there. Ensure. I'm just muting everybody so that my flow of thoughts, you can unmute yourself.
Yes.
So you can always go and with the IMA people, and as a team it works. Second thing was about notes. Once notes have been submitted, please do not alter them. Once notes have been submitted, before submission, you can take help of all your colleagues, all your teachers, all your seniors, and you can modify them. I can say that, because whether you've done or not, it should be written.
Yes, sir.
You should take the help about writing out the PSC notes, intraoperative notes, complication management. Whether you've given some particular drug or not, that is secondary thing. But if you think that this should have been given, it should be written. But once they have been submitted, please do not alter them. Third thing is was about interest of members. I was thinking you will be saying going up. See, interest of members in different activities of ISA has been going up and up only in spite of COVID. I disagree with this thing strongly. It has been going up and up in spite of COVID. Now, if we think that our second webinar of ISA done on 23rd March had views of 8,000 and subsequently views of 2,000, 10,000. 16th October, our World Anesthesia Day online function celebration had views of 22,000. See, those were the beginning days where members were enjoying the online activities. Now, every day there are 3-4 activities, and how will members attend to such so many online activities? So, at the end of the day, whether it is physical activities or online activities, excess of everything is bad. But otherwise, I am very happy that the fire which was ignited at the national level, it has now percolated to the remotest of city. Lots and lots of programs are being held. If some city branch is not able to hold a physical meeting, because a physical meeting will cost a place, a cup of coffee, cookies, at least 5,000-10,000 rupees. They can do it free of cost, 45 minutes free Zoom. They interact online. So online thing, they are very, very happy. And for the bigger branches, there are, see, Maharashtra, they are doing master class, they are doing expert session, focus section, focus section. You take of anything, all branches are doing some same way everywhere. You can talk from north to south, because as a secretary, they call me. So I always say, please, give me chance in the beginning so that I can come back to my clinical work. But lots and lots of activities are going on, and members are really very happy about the activities which are going across the country under the banner. Whether since moreover my office and we are following around 250 groups, so all the activities are going on. You talk of Punjab, they are having series of webinars on research methodology. You talk of Bihar, they are superb in their webinars and CMEs and exam-oriented sessions. Maharashtra, I've talked about. Andhra Pradesh, lots and lots of activities, and now they switched over to CMEs, back-to-back 3 CMEs. And Telangana, regular webinars are going on. Kerala, earlier it was weekly PG classes, now it is fortnightly online classes are going on. Puducherry, they have got their Puducherry update. Rajasthan, lots and lots of activities are going on. Gujarat webinar, they are now they are coming up. Gujarat, I am happy to share with you all that they are now coming up with music webinar. If we had academic webinar, they will have music webinar, and that will be followed by Maharashtra also. So now we are starting with music academic webinar. Now it is music webinars. So people are getting this thing. You talk of sports, your own state. Nagpur is doing intercity sports competition. Your own state is doing Yuva Marathon, right? So you talk of anything, and all the things are going on day in and day out. And even Delhi is doing YuvaCon. Delhi monthly meetings are going on. And I'm sorry, I'm missing some states or not, but I remember Madhya Pradesh, Bhopal, Indore, they're all doing all activities. UP, they're all state executive. The latest one is renal transplant one. You talk of Northeast, West Bengal, Calcutta. Calcutta is doing lots and lots of activities, and they are now coming up with the PG assemblies also. Odisha, they are coming up with live workshops and PG assemblies also. Srinagar is doing its activity. Himachal Pradesh, a small state, they recently had a very, very nice activity being done in their place. So Chandigarh is doing lots of activities. My own state, Haryana, we have got lots of activities going on. So it's all across the country. You name any 29 state branches, they are being covered.
Yeah, so, one question left, sir. Why are private practitioners not becoming members of ISA? One question asked in the chat box. That's
Pankaj Gupta has been talking this thing about private practitioners.
Yeah, that's what I asked you.
So I think my perception is slightly different. What we have done in our places, so we have Dr. Yogen, but finally here with us. What we have done, Pankaj, in our state is, our ISA Haryana state president till date has been a private practitioner. Dr. Balbir Chavda was our head who founded ISA Haryana state branch, and he said that we have to strengthen the periphery. So never ever in the history of ISA Haryana, the president has been from medical college. He has been from private practitioners. So I can say with my own personal experience, if you give them power, give them responsibility, they will definitely become members. So it's up to the city branches that the private practitioners, they are involved in some form or other at the in the executive body, and then definitely they will motivate others, and they will definitely become members. This problem maybe there in some parts of the country, but generally I can say you record number of members 3,000 per year. See, 3,000 is usually the total strength of any body, any other body in the country, right? They can be 3,000, 4,000, 5,000. We are making 3,000 members per year. Right now we are how many short of 37,000? 93. So we are 93 short of 37,000. And with your support and blessings, my office boy just told me that we are 36,907. Yes. 36,907. And he's after, I have told them, we are all doctors, they are busy. Once they submit 8,500 rupees, you follow up them with their papers and their certificates, chase them. And if they are angry also, भेज देंगे सर्टिफिकेट, आ जाएगा सर्टिफिकेट, साइन फॉर्म आ जाएगा, डोंट गेट एंग्री। कभी कभी बोलता है कि सर मुझको गुस्सा हो जाते हैं, मैं तो आपके बिहाफ के ऊपर फोन कर रहा था। बट एनी हाउ, so 3,000 members per year regularly, even in the COVID time also, we had around 2,200 members. We'll touch 50,000 very soon. Our aim is to make it the largest body of anesthesiologists, not in India, but all the across the world. We'll make it. So there are other questions.
Thank you, Naveen, for, I think so, chat box questions.
I'll
answered.
Dr. Ravinder,
Shilpa can take other questions from the members.
Yeah, sure. Dr. Ravinder, sir, please, you are joined from US. So please, you can ask your question. Then we can, yes, sir, unmute yourself. Good evening, sir.
Good evening. Good evening to everybody. Hearty compliments to the organizers for making such an informative session and including one of the best speakers ISA has seen in the last so many years, Dr. Naveen Malhotra. We were also very fortunate to have the president, Dr. Venkatgiri sir, also to address us. Just one little thing I wanted to mention here, since all the stalwarts are present. The PAC clinics run in hospitals and medical colleges are usually delegated to the junior most postgraduate. I think a little difference has to be done if we want to establish the identity of the anesthesiologist among the patients and their relatives. That is number one. And number two, all the seniors have to ensure what you have mentioned in your speech, record keeping must be maintained in a very strict fashion so that subsequently we can save ourselves. And one little correction, Naveen sir.
Agreed,
2000 saw the establishment of a West Bengal ISA trust, which owns a 4-storied building in Kolkata city, which I think Dr. Venkatgiri sir remembers. We had submitted the documents.
I have also seen that, sir, and that was a miss. I'll add it to my presentation, sir.
That is possibly one of the first buildings that ISA owned in the country. Anyway, that's just by the way. Anyway, once again, thanks to the organizers and thanks to you also, sir.
Thank you, sir. Thank you very much. So I'll just cover up the questions. Dr. Mohan Patak has asked, nowadays attention in OT is diverted by mobile, sometimes dangerous. No doubt about that. In our institute, we had made a rule that you won't be having doing any activity on the mobile except for calling your seniors in case of emergency. That's for postgraduates and senior residents. You can discuss lots and lots about benefits and the thing. We have stopped all those because residents can be on WhatsApp, they can be on Facebook, they can be on Shopping Mintra and other things. So that's the answer to that thing. It is totally dangerous. And then compliments, sir. If Dr. Milind Pol is asking that if on table death occurs, I have written all notes accordingly. I am sure I am not negligent. I want to avoid court matter. Yeah, that's a natural thing. And if the relatives are ready for off-court settlement, what should I do? Dr. Milind Pol, my answer is, if you can buy peace, buy it. If you can buy peace, buy it. But be slightly slow in going for out-of-court settlement. Otherwise, the mouth will open such big for the attendants. They will ask for a big bounty. Just have patience. Let the sentiments die down. When the religious ceremonies are over, when the relatives have gone back, the things will start settling down. Their tempers will start settling down. They will also understand that this is a good doctor. This has happened inadvertently. And then you can go for an out-of-court settlement. The professional indemnity insurance scheme, which ISA endorses, has got this out-of-court settlement scheme also. And definitely, I firmly believe if things can be settled out of court, then there is nothing. If that means by financial things, there is no harm in that. Otherwise, if court case goes on, then you should not be very, very aggressive. Let the court case drag on. You just keep on doing your activity. The tempers will automatically cool down. The other question is by Dr. Gauri Arora about the notes, whether they can be added once their records are ceased. No additions, no alterations to be done later on. Then we have got about the on color coding of drugs. Definitely, we have been actively following up since lots of things which are having a namesake or the color, the ampules are same, and we have been following it up with the pharmaceutical companies, and they have readily changed. Whenever it is brought to our notice, we simply write to the both the firms that these two ampules are similar, and you have to have different ampules. so that there is no accidental administration of drug. We simply follow it up. I can say you communication, official communication with any body, whether it is the pharmaceutical, whether it is NMC, Niti Aayog, PMO office, Ministry of Health and Family Welfare, and National Board of Examination in Medical Sciences. You take anyone, we can correspond with that body with the provided thing, only thing that we keep our homework pakka, that our letter should be very, very fine. Couple Singhal has written some good words. Okay, some more good words. Yeah, Tanveer says from Punjab Secretary that we should ensure writing name of anesthesiologist along the side the surgeon on discharge card. Yeah, that will be that's an excellent idea. But then you just please, we should follow it up in our post-op visits also. That's a good idea. What's the role of ISA in designing the curriculum? Yeah, I can tell you. This is a Pixel 4a. It's a very, very important thing that they have asked. Yet that we are actively involved in, we are called as an experts in our own individual capacity and as our ISA office bearers also. Like I was convener of Specialist Board of Anesthesiology in National Board of Examination in Medical Sciences for 3 years, during which time we ensured that we are able to start fellowship National Board in Pain Medicine, which is now coming. We have started FNB, onco anesthesia course and curriculum was passed at that time. Trauma anesthesia and critical care, pediatric anesthesia, obstetric anesthesia, they're all coming up. That process was started that time. Two have seen the light. FNB onco anesthesia has been notified, and FNB pain medicine has been notified. Curriculum, everything has been designed, and now it is NEET Super Specialty Exam 2022. It will be held. And for the undergraduate, when it was being designed, they were cutting the lectures, and I was actually involved in that also. I know that we ensured that our total number of hours of teaching and training, they are not reduced. The most important point which was against us was that 50% of the medical colleges in private setup, they don't take the allotted classes. Now it's imperative upon us, on the teachers, that we should ensure that whatever the classes are allotted to us, in the revised curriculum, we have got focus sessions, small group sessions, and teaching hours, they are less. We have been clubbed with dentistry, take those lectures also with you only, and ensure that you take this, because they are now, everything is now recorded. It is now all recorded that who are taking classes, who are not taking classes. We were able to, our aim was to take a half paper of anesthesia in surgery, but at that time we were on back foot. It was about to be slashed altogether, but we were able to convince them, okay, let's maintain the status quo. We had our number of hours, theory hours, clinical hours, and 15 days posting in internship preserved. So theory hours in 4th year, practical hours in 5th year, and our internship 15 days there. Labor eligibility should be part of curriculum. It definitely is. Dr. Avinash Bhosle, I want to ask, sir, please, Dr. Bhosle, please ask the question, and then Dr. Reddy has also raised hand, and Dr. Viresham has also raised hand. I'll take up the next question subsequently. Dr. Avinash Bhosle first, then Dr. Reddy Prasad, and then Dr. Viresham.
Sir, thank you for the appreciation words for us. My first question is, if there is a bad incidents happen and people pressurized to give, they said to submit the documents to us. They pressurize. So the notes are incomplete. So can we write these notes are incomplete? Is it accepted?
No,
and
sir.
I'll
reply to that first, sir. Before submitting, you can take as much time, because I was busy managing the clinical, managing the patient clinically. You have to submit the records to the hospital where you are working. If it is in a medical college, to the medical college, or in a private hospital, to the hospital. Once they are submitted, whether they are incomplete or complete, they will be taken as final notes. You won't, because they will be photostat, scanned, everything will be done. So before handing them over, go to the washroom, wash your face, have a cup of tea, lots of sugar, take help of your colleague, and complete it, sir. You have to be
there. Sometimes the people pressurize us to submit them as early as possible.
I'm completing it down. You have to buy time, no, sir. You have to buy. You should be smart enough to go to a room on a different floor.
Yes.
And simple thing.
My second question is, there are now many Ayurvedic surgeons, gynecologists, and other. What is our stand? And second question is, if anything happened wrong there, should we support our colleague to in that matter?
Sir, I will be categorical in saying that we do not support employing Ayurvedic surgeons or conducting anesthesia for Ayurvedic surgeons. As simple as that. This has been amply discussed. I repeat, we do not support conducting anesthesia for Ayurvedic surgeons. We do, if you are in a position of employment, suppose you have got your own hospital, you and your wife have your own hospital, we do not support you employing these doctors. This is a clear-cut stand of ISA.
Second question is, if this happened, should we support our colleague or not? This is a question from our.
At the end of the day, we are a giving body, sir. ISA is a giving body, not a taking body. So we have to support our member, no doubt about that. We have to take him out of the crisis. But as you in the first place should not do it. And later on, you should teach him also, please. Now we are taking you out. You are in problem. You should not have done it in the first place. But since you are in problem, we are supporting you because you are our own colleague, you are our ISA member. So we have to support you. But ISA is a family, sir. We cannot leave our family members. Suppose in our family member, you and my son does something wrong. Will we leave him because you have done wrong and we are not there with you? No. We will try to, okay, beta, you have done this thing wrong, but we'll try to bring him out of that trouble, safeguard him, and then advise him, please do not do it again. अगर उस वक्त उसको छोड़ दिया सर, तो he will become a rebel. So as a family, we have to protect our members. Once एक बार इसको बाहर तो निकालो प्रॉब्लम से, फिर उसको आराम से 2 दिन बाद 3 दिन बाद teach. Please do not do these things. He will listen to you, he will follow you, he will obey you.
Okay, thank you, sir. Okay.
Dr. Reddy Prasad, President ISA AP.
Good evening, sir. Good evening. Excellent session, sir. I got 2 questions, sir.
Please, sir.
Do you advise anesthesiologists to take a separate consent for all the anesthesias besides what the nursing home is taking? The nursing home, they will take for surgery and for anesthesia. But for high-risk cases, sometimes we take consent. Is it to make it routine? Sometimes we may land in unforeseen problems. So do you advise to take a separate consent for all the surgeries by all the anesthesiologists, especially those who are freelancing?
As a policy matter, yes, sir. As a policy matter, yes. There is a separate anesthesia consent form, especially for the private practitioners. Suppose you and me are working in a medical college, sir. We are protected by an umbrella there, right? This is the system in which this hospital works. There is a vicarious liability of the medical student also and director also. And we are somewhat protected. But as a principle, we promote, we support, we advocate separate anesthesia consent form. It is available on the ISA website. You go to the PPF and there are PPF guidelines in that. So the consent form is there as an anesthesia.
So second question.
Yes, sir.
Suppose if there is a massive attack from public and the police also entered, if somebody demands to hand over the records, who is the authorized person to whom we can give? Can we give to the say sub-inspector or sub-inspector from the police station or to the?
No, sir. There is no need to give any record to the police inspector. They cannot lodge a criminal complaint as such. The record has to be handed over to the civil surgeon when you get a record in writing, sir. As per the Supreme Court guidelines, clear-cut judgment is there that no criminal case can be lodged against a doctor until unless it has been a committee has been formed by the civil surgeon, chief medical superintendent, whatever you call in your state. In our state, it is called as civil surgeon, and that committee recommends that there has been negligence on the basis of records available. So that record has to be submitted to the your own civil surgeon.
So police got no right to demand to hand over the records.
They usually ask for it. They usually ask for it, but they cannot register an FIR in the first instance, sir. As simple as that. So what record they want?
Okay, sir. Thank you.
Dr. Viresham, and then I'll come to Dr. Atul Gandhi.
Sir, good evening. excellent talk by our National Secretary, Dr. Naveen Malhotra ji, and good added up from our President, Dr. Venkatagiri. And I want to ask, the question is, say, if something happens in the situation, because if you call the local executive also, they are not that much experienced in sometimes. So can we take advice? You have also mentioned the seniors, advisors who have been experienced through all these stages. Can we take help and write the record? And record, while you are, can we have a talk with personal talk, what you told? We can write record according to them. If anything missed also, they can mention within 1 to 2 minutes. These things you can put, because if some advisor is there, like advocacy, some has done LLB or something in our profession, we can also take some advice from them, or we can write some additions in that record, whatever you record. And what I feel is, once you record it and you take a snap of it also before giving to your own hospital, so that you can have whatever they may alter sometimes. Sometimes they may be under the influence of surgeon or somebody, so they may alter. We can have a snap of it for you after your signature in that record. Is it advisable to take a snap of your record? Photocopy of.
Absolutely, sir. Both the things are normal things. And you're absolutely right. We can take help and advice of our seniors, our colleagues who are got a legal bent of mind. Definitely, you can take it. And it is no harm in taking a. Everybody has got a PDF scanner in their phone. You can take a picture also. You can scan those documents quickly, and they are for your ready reference. Absolutely no.
Because we can discuss with our legal advisors, personal legal advice without PDF, because it will be sent. So we don't have any records. That is why, can we take like that?
It is usually the hospitals also, before sending the documents, they keep a photocopy set with them also, sir. So, but still you can have your own also. And Dr. Neelam, related question she has asked is Dr. Neelam Nalge, when we are called for help in emergency by our friend and patient dies on table, are we equally responsible legally? No. See, you have gone there when a complication has occurred. This goes in favor of your friend, that in case of a problem, he has called a colleague, and yes, he can document that, okay, I called Dr. Naveen Malhotra for help. And so even if she puts your name, don't be afraid in going to court of law. You can always support your friend. Court may giving some if you're summoned to court, giving your evidence, going as a witness, absolutely don't be shy of that. You should learn all those things and be supportive to your friends. So absolutely, there is no legal responsibility, but it goes in the favor of your.
Sir, one more question. One more question, sir.
Yes, Doctor.
One more question, sir. Sir, if somebody is asking whatever our AP president has asked the legal documents, you already told that you should not give to them unless the FIR only. If they say that we have to put a case on your records, that is why we are asking.
Sir, so they are not entitled.
That's what.
As per Supreme Court judgment, they are not entitled to register a case, no, sir.
Yeah.
They can only register a complaint. By the attendants will go there, they will register a complaint. That complaint has to be forwarded to the civil surgeon. This is the normal course, sir. The attendants will go to police. Police will register a complaint. That complaint has to be forwarded to the civil surgeon. We will formulate a committee. That committee will give its report, and all the documents will be submitted by that committee to the investigating officer.
One more question is, our MD degree, can we include on behalf of ISA to write a letter or something forcing them to include in the basic sciences as a curriculum of their education, MD anesthesia course? Like that, they can be examiners, they can be undergraduate teachers, like that, basic sciences curriculum.
Sir, please repeat your question, sir. Please repeat your question.
MD anesthesia course, till now it has not been recognized in the basic curriculum, basic sciences course, like MS General Surgery or MD General Medicine or MD Pediatrics, like that.
You mean to a separate subject in MBBS?
Not subject, almost. Otherwise, it cannot be included in basic sciences.
Sir,
Or some chapters.
Sir, as far as there are two things I'm very clear about NMC. As far as separate subject is there, we were fighting for it, but we were able to save whatever we had, the theory hours and practical hours in 4th and 5th year, and internship 15 days. But we are gradually thinking of half question paper in surgery. Then subject NMC is very clear that we are going to offload the students, and they themselves have redesigned the structured completely recently. So seeing anesthesiology as a separate subject, independent subject right now, I don't foresee in the near future. But if we keep on teaching our younger residents like anything, in the basic foundation course, we've got lots and lots of activities. If we don't die down the spirit or bonhomie which we have created, if we keep on doing our work nicely, now everything is computer recorded, which college, which thing is being done by anesthesiologist. So that can be taken care. As far as what else you want that we should do, sir, Dr. Vireshan?
No, that's what. Some even question papers also, 2 or 3 questions.
Sir, we are fighting for half question paper in MS General Surgery. There are 2 papers, and we are fighting for half set. But first, the onus is on us. For next 2 to 3 years, we have to ensure that we are taking 100+% classes across the country allotted to us. Right now, the figure is that only we are taking 50% of the classes. At some places, sir, they have shown the records that recorded videos are played in the auditorium for the students. So we have to overcome our shortcomings. Then only we can fight for anesthesiology as a separate subject. There was another question by Dr. Rajesh Rao. Can we have an SOS button in ISA app? Yeah, that's a good idea. That if there is anything push button or SOS button, we will definitely develop over it, ISA app. And I'll request all of you to please download the ISA app. Rajesh Rao, I'm happy that you have downloaded it. It's available both on Android and iOS. Right? In the meantime,
third question is state office. State office for each state. Any backing from the ISA national for doing that job? Financial backup.
You please come up with a proposal, sir.
Yes, sir.
That Telangana, you are state president of Telangana, form up proposal that okay, we are suppose we want to pay 75%, please give us 25%. Or see, we will always be there with you, sir. But yes, come up with a proposal, and definitely we should have offices. In almost all branches, we should have offices. See, Jabalpur recently inaugurated in IMA Hall. Bareilly does activities in IMA Hall. West Bengal, we were talking. So once there are offices, you need a place to sit, sir. There's an old saying.
Yes, sir. Yes, sir.
You need a place to sit, then only you can develop.
Yes. Thank you, sir. Thank you. Thank you.
Gandhi has said that can we fight or represent the insurance company for separate anesthesia? Yes, definitely. That is going on full swing. And separate charges for anesthesia, for third-party assurance also, and that is in almost final stages. I can tell you the letters are being written. Nishant Sai from Patna is writing, can ISA collaborate with foreign anesthesia societies to facilitate student and faculty exchange program? Yes, Nishant, we are actively working with Royal College of Anesthetists, and because of COVID that got delayed, but now since we are over with the COVID pandemic, initially they were even interested in starting online collaboration, but we believe that online won't be much useful. Our students going there and learning, and we are also in touch with Australian Society of Anesthesiologists also.
That's video channel.
Dr. Shweta Satwangkar writes, in hospital consultation list, anesthesiologists are never mentioned. Madam, you have to fight for it. Ensure that in your hospital website, you are listed in the Department of Anesthesia, and your all achievements in your OPD in pain clinics, your name are written, your OPD days are written, and you have to, because your consultation you are giving is in the form of PSC clinic, in the form of pain clinics. So you have to ensure that they are mentioned as these are all things which you have to market yourself. Absolutely no issues with that. And excellent presentation.
Sir, can I?
Yes, Dr. Atul.
Yeah, sir. Good evening, sir. And thank you very much, Borivali branch, and such a nice webinar. सर हमारे जो अहमदाबाद में एक इंसिडेंस हुआ था, आपके साथ कंटिन्यूसली बात कर रहे थे, तो हमने एक अलर्ट ग्रुप बनाया है यहाँ पे कि कुछ भी हो जाए इमरजेंसी में, तो अलर्ट ग्रुप में से तुरंत 5-10 आदमी डॉक्टर्स वहां पे चले जाते हैं. अभी तो जनरलाइज कॉमन किया है, तो इस अलर्ट ग्रुप में कोई भी अदर मैसेज नहीं आता, ओनली इमरजेंसी से है. सो अभी इंसिडेंस हुआ था एक महीने पहले, तो सब 10-12 डॉक्टर वहां पे कर चले गए थे. अभी हम कॉमन रखे तो सेपरेट एनएससी अलर्ट ग्रुप बना सकते हैं ऑफिशियली आईसी सिटी ब्रांच के.
बिल्कुल बनाइए सर. I am what you are saying is because there are people from different parts of the country also. I'll just translate in English. What Dr. Atul Gandhi is saying that we should have a WhatsApp group of emergency response system type of thing, whether it is medical legal, or it is medical or clinical also. Definitely, that's absolutely good idea, and where you can respond to the colleagues who need help. Absolutely fantastic.
Thank you, sir. Thank you.
Dr. Mohan Pathak has asked, one anesthetist was pushed in custody along with gynecologist as she advised treatment on phone under wrong IPG clause. He did not get justice. I'm not aware of this case, so I won't be able to comment on it. But as per the NMC guidelines released 3 days ago, now you cannot give treatment on social media or phone. It is very, very clear. Please go through the announcement and the guidelines which have come from NMC 3 days ago. Please do not give any advice on social media or on phone. And similarly, you cannot advertise your patients on Facebook. You cannot do promotions of your own by inviting followers to your Facebook post. Gita Scenario is complimenting. Somebody wants a sincere thanks. Very practical questions, very important. Request to make mandatory PG a life member of ISM Medical College the day joined. Yeah, Dr. Lalit Kumar Pandey is saying that PGs, it all depends upon HODs. They have to do it. We became member, our HOD told become ISM member, and we simply fill the form, 1250 rupees at that time, and we became the member. So this is the duty of our HODs to ensure that we have to become the members. Other question is ALM inactive life members. The procedure is absolutely simple. Please write an email. That I again repeat, these are all technical things. As a class 1 officers, we don't need to deal into it. This is an office work. They are doing it. For ALM to LM, please send your MBBS degree and registration. For inactive active, please send your email ID, mobile number, and one ID proof to isahq@gmail.com. If you have issues in logging to email, WhatsApp to 9091515151. I repeat, isahq@gmail.com, 9091515151. Inactive to active, email ID, mobile number, ID proof, ALM to LM, your ISA number, and your degree and its registration. Neeraj Kumar Patna is asking, many of the colleges already started training MBBS students taking basics of anesthesia. Can ISA platform provide initial suggestion for MBBS graduates regarding anesthesia basic training? Yes, we are working over it. Our aim is to first have a uniform PG curriculum and then have got uniform UG curriculum to have across the country, so that MBBS students are attracted towards anesthesia and its different specialty branches. And thank you, good, excellent session. I think I have covered all the questions. Dr. Saleh sir wants to ask, and then I'll go to yes, please.
Good evening, sir. I have one question. Excellent information today. Most of the police stations we have come across, that's what Mohan Pathak was also trying to bring to your notice. That case is from Maharashtra itself. Most of the police stations, what we have observed is they don't have proper information, particularly at the police station level, PI or the person who is sitting junior person. And they put some other IPC code, and then they try to, we are the soft target. They always try to. How all the police stations at the headquarters and commissioner level, all the rules and regulations, everything is there. They know what are the Supreme Court judgments and everything. But these things are not getting percolated to at the lower level police station. And they make the soft target of this. How we can make all the police stations across Pan India that they should know this Supreme Court judgments. They are not aware. This is what we have faced.
Sir, the honest answer is that as all anesthesiologists know that PAC has to be done, but they don't do it, in table. Similar way, all police stations know that they cannot do it, but they simply garb under the fact हमें तो उस ruling का पता नहीं है. We don't know that judgment. This is, they know each and everything, sir.
They know.
They know. They just pretend because they know doctors are soft targets. So in your team, have a tough nut also. This coach who is not afraid of going to the police station, who is not going to has any difficulty in talking to the SHO or the sub inspector or the havaldar. Sir, वो सब हमसे post में बहुत छोटे हैं. They are much junior to us. We are the cream of the society. The only thing is that we feel bad why it has happened to us, and we are emotionally soft people. और anesthesiologists तो sir वैसे भी soft है. We anesthesiologists are very good at heart. We cannot, barring few who are very other things. Otherwise, 99% anesthesiologists are very soft, good human beings. उनके मरीज के साथ कुछ हो जाए तो उनको इतना दुख होता है कि बेचारे खुद ही दुखी हो जाते हैं कि ऐसा हुआ ही क्यों उसके साथ. अरे आपके साथ तो हुआ है पर पेशेंट के साथ ऐसा क्यों हुआ? Why it has happened to my patient? So otherwise, sir, legally I am telling you, they know each and everything. They pretend that they don't know. The moment, sir, बस वहां पे थोड़ा सा होता है कि भाई आपके पास वहां पे एसपी का नंबर, एसीपी का नंबर होना चाहिए. Just call them. It has happened, sir. वो आपके भेज देंगे, सम्मन भेज देंगे, थाने में आ जाओ. अरे तू कौन होता है बुलाने वाला? Who are you to call us? Right? So just you should have the number. ये तो एक जो आप अपनी डायरेक्टरी बनाते हो फोन नंबर्स की, उसके अंदर we should have number of your PS2 MLA, PS2 MP and PS2 SSP, SP, इनके नंबर भी होने चाहिए. DC and हमको अपने फंक्शंस में बुलाओ ना सर. When you are having your city branch activities, call them to your functions, honor them, guest of honor. It is a give and take, sir. Until unless you call them, they will not know you. You will not know them. As simple as that, sir. Right. Dr. Shilpa has raised the hand. The host has raised the hand. Unmute yourself, please.
Yeah, thank you, Dr. Naveen Malhotra, sir. You are answering each and every questions. Last 2-3 questions. Some members from other branches have asked me what is the present procedure to form a new branch. Is that somewhere written on the website?
New branch?
Yeah, someone wanted to form a new branch.
It is absolutely loud and clear in our constitution, in our rule book. By the way, I'm telling you, our Constitution 2022 will be there on the website in June, and rule book also will be there in June on the website. It's almost in the final stages. I've been working over it since my team has been working over it over last couple of months. But this is an old thing. For forming a city branch, you need 21 members. 20 members are sufficient to form a city branch, ISA members. And you have to write, the step is very simple, to the Honorary Secretary, ISA National. Subject, formation of ISA -- city branch. Dear sir, we the anesthesiologists of -- branch, or we the anesthesiologists living in Rohtak, living in and around Rohtak. Suppose you want to include some peripheral within 10-15 kilometers, 20 kilometers area also, who are attached to your branch. We the members living in and around Rohtak wish to form a city branch of Indian Society of Anesthesiologists. We shall follow the Constitution of Indian Society of Anesthesiologists National and shall do nothing contravening to the rules and regulations of ISA National. Please permit us to form the branch. The required branch fees of 2,000 rupees has been transferred to ISA National account on this date, wide reference number this. Thanking you. Name, ISA number, signature, mobile number, email ID. And once I receive this email, I will say your branch is principally approved subject to governing council approval. See, I have to follow the protocol also, but we principally, I will check from the software. Okay, these 20 members which you have quoted, they are members of Rohtak, suppose they are ISA members, their address is of Rohtak. ऐसा ना हो कि they are somebody in Delhi, somebody in Himachal, their address is also of Rohtak. So principally approved subject to the formal approval by the governing council and the GP. Then that is done. So this is the procedure for formation of a city branch. For state branch, we need 50 members, and that's an issue. It's a very simple thing, man. You can do this in one day. You can do this in one day. Definitely, if some city branch sends an application directly to me, I will inform the corresponding state branch president and secretary that an application has come from your state. This is for your information. But otherwise, they can always keep you in loop by marking a copy to you. But otherwise, I'm utilizing this forum to tell all of you. I've been receiving lots and lots of communications from the state president and secretaries and city president and secretaries, where they mark copy to so many people. As per Constitution of ISA, the National Secretary is the corresponding authority. You have to write a letter to the National Secretary, and please do not mark copies to so many people, because then a trail mail starts. The GC members of your own zone, and yes, if your city branch is writing, he or she should mark a copy to the state president and secretary, because it has to come through a proper channel. But if a state president or secretary is writing a letter, then they can mark, the secretary should mark a copy to the state president, address to the national secretary, copy to the national president. That's it. Marking a letter to so many people, it's my duty to inform my own governing council members. And it is your duty to inform your own governing council members. Please do not mark copies to so many governing council members. President, secretary, address to secretary, copy to president ISA National. If city branch is writing, copy to president and secretary of state branch. If state branch is writing, address to secretary, copy to president ISA National. That's it. Okay, so city branch formation, please motivate. Right now, we have received proposals for formation of branches from recent one is from Mathura in UP, and Tanveer is planning to form a new branch in Punjab in Roopnagar. They are getting together, so they are collecting the names, and this is so these two are the new branches which are being formed. And recently in Andhra Pradesh, 3 branches were formed: Nandyal, Bhimavaram, and Dr. Reddy, third branch was Bhimavaram, Nandyal, and
two branches, sir, Nandyal and Bhimavaram.
And then Tamil Nadu also, we have new branches formed. We went for their inauguration also, and Dindigul, Tuticotai. There are different branches which are being formed across the country. Most welcome. In Karnataka also recently a new branch has been formed. So if there is anybody wants to form a branch,
yeah, that was
even they can simply call 9812091051. I will be available, and they can, if there are any doubts or clarification, they can simply call me personally also.
Yeah, that was a question from a city branch outside Maharashtra. So second question, may I, can interstate GC meet be arranged during state conferences and made compulsory? Interstate. Within the state, all the GCs are meeting, but I feel there is less. Like last 2-3 days, I have been just talking for 2 minutes with some state president secretaries and city president secretaries. And I feel there is lack of, or maybe we are not actually interacting physically. So can we have interstate GC meet during the state conferences? Or can zonal president secretary meetings be arranged during the state CMEs, made compulsory? What is your opinion?
Constitutionally, we do not recognize zone president and secretaries, to be honest. Zones are recognized, zonal conferences are recognized, but zonal officer bearers is not a constitutional post as per ISA National Constitution. For your knowledge, we have been holding regular meetings with ISA state branch president and secretaries regularly. Since last, I don't know what was in the past, but last 3 years we have been holding regular meetings. Some of you are here, some of the new office bearers, some are old office bearers also. Whether during COVID pandemic, we used to have any important decision was taken, we used to take into confidence ISA state president and secretaries and give this responsibility to them to get in touch with their city branch president and secretaries. And we had in this few months ago also ISA meeting with state president and secretaries. So ISA National firmly believes that if I have written in my talk that you are our backbone, so I mean it in letter and spirit. With all honesty, we believe that you are our backbone. And for any important decisions, we definitely get in touch with our state branch president and secretary. Few occasions we have invited city branch presidents, secretaries also. But the problem is that it is easy to interact with 58 office bearers, but 29 into 2, 58 branches, 58 office bearers. But interacting with 404, we will try, we'll have patience, and at times the protocol has also been followed. Suppose you want to make a point about Borivali, it should be in tandem with the thought process of Maharashtra ISA chapter. You should not be contradicting your own state. See, that is very bad situation. Suppose a proposal is coming from your own state and objection is also coming from your own state. So we don't want the state officers to be in that uncomfortable positions, and we also don't want to be in our uncomfortable position. That is the most, and this is my word of suggestion to all state branches, and especially the city branches. Please do not contradict the things which your state body is doing. A meeting is being held, why it is being held, why it is being held on that day. This has been given to them, why it has been given to them. Please, please, please. So we don't want that sort of condition where your own city branches are contradicting your state body. We want that everything should work in tandem, in synchrony, and hierarchy should be maintained. Please respect your state branch office bearers. The hierarchy is very, very clear. ISA National Governing Council, then State Governing Council, and then City Governing Council. ISA National President, ISA National Secretary. Look, our hierarchy is also clear, right? President, Vice President, President-elect, Secretary, Treasurer, Editor-in-Chief, and Past President, and then GC members. So the GC member, till at the national level, is senior to the State President, Secretary, Vice President, and like that way. And the GC member of state is senior to the City President, Vice President, Secretary, like that. So please maintain that hierarchy. Rise above the ladder with your own merit, with your own hard work, but please follow the, please keep your state office bearers in loop. Don't bypass them. Even if you bypass them, I tell you, I inform them. Whatever is proposal comes from any city branch, I ensure that that state branch is kept in confidence. So that is the thing.
So can we have few words from Dr. Manisha Katekar madam and Dr. Anita Nehete madam?
Where is Dr. Yogen? But it logged. I think.
Dr. Yogen, but sir, I could see sir for some time. Yeah,
Is
Dr.
there?
Yogen, sir, can we
I'm
have
very much here. I am on mute mode. That's all. But I am enjoying this conversation going on. Extremely thankful and extremely happy to see all of you here. It was a very good session. Thanks a lot. I was traveling, so I couldn't attend in the early part. Thank you. Dr. Manisha, please go ahead.
Respected Dr. Naveen Malhotra, sir, it was really an excellent presentation, and so many doubts in the anesthesia, in the minds of anesthesiologists of all state and city branches. There must have been, I think, there were many queries regarding the ISA membership, ISA city branch activities, and so on. So most of them must have been solved. I just want to add a comment, sir. I would like to mention here that all the presidents of Maharashtra State Chapter ISA and secretaries of Maharashtra State Chapter ISA till the date, and including the Borivali ISA branch president and secretary Yogen Bhatt sir and Shilpa madam, all are private practitioners. So that's what the comment I wanted to make, that we all are private practitioners. So all the past presidents also, they were private practitioners, and YB sir is one of the biggest private practitioners, a guru to all private practitioners.
Before you say further, any few words, madam, I am happy that Haryana and Maharashtra are on the same page on this, because we have also this history that we always make private practitioners the state president. Dr. Yogen Bhatt sir, I still vividly remember April 2019 when we visited the Borivali CME, which was organized by your good self, and I echoed my words for you. I just like to take this opportunity to echo it again, because I hold you in very high respect, and not just because of your age, but because of your words and actions also. Yeah, it was my misfortune that you were driving and not listening to my talk completely.
No, I heard the talk, but only I could not keep my video on. That's all.
Yeah. So that I had in my presentation expressed my emotions for you, sir, and like to share with you again. Maybe you have in the traffic. This was about the leadership of the office bearers, and for any ISA branch, a leader is one who knows the way, goes the way, and shows the way. And I find you one among them. And you are a man who is a guide and patron to Borivali branch, a man with clear thinking and appropriate actions. And this applies to you. The key to successful leadership is influence, not authority. So these are my emotions for you, sir.
Great. I'm extremely thankful for the kind words that you have. I'm so glad that all the branch members are very much with me all the time, and so are all Maharashtra committee members, all office bearers. They're extremely kind to all of us. Thank you very much. Thanks to all of you. A good leadership matters, and that is where the flow is coming from you. I'm proud of that part. Thank you.
Dr. Anita Nehete, madam, do you want to say a few words?
Thank you, Shilpa. Respected Dr. Naveen Malhotra, sir, this was really great. It is a pleasure to listen to you, but it is really much needed. And I can see that all the office bearers from various state and city branches are logged in to know, and they're asking questions. They are taking active participation. And this really shows that we are progressing as a team, we are progressing as a society. And thank you very much. Thank you.
I must place it. Thank you, madam, for such kind words. I must place in on record good work done by Dr. Shilpa, and there were office bearers from Himachal Pradesh, from Chandigarh, from Punjab, Haryana, Delhi, Rajasthan, Gujarat, MP, and Bihar, Jharkhand, and Andhra Pradesh, Telangana. Shamshad Begum madam from Kerala, obviously the whole state of Maharashtra. So you covered almost entire India with this thing. I may be missing few names also that I simply just remembered by seeing the names which were there. So you have covered Dr. Bhaskar is from UP and Dinesh Singh is from Bihar, Jharkhand. So I can just saying Paul Rafal is also joining from Kerala. Dev Sanjay Nag is from Bihar and Jharkhand. So there are people from West Bengal also, Dr. Bindari joined. So you covered almost all country. So I am thankful that this gave me another opportunity to interact with my very, very dear office bearers, who I fondly say that they are definitely the backbone of our ISA.
Thank you so much, sir, for your kind words. As Dr. Yogen Bhatt, sir, and Dr. Manisha Katikar, madam, said.
Thank you, everybody.
Thank you so much. Thank you.
You're muted, madam.
Please unmute Shilpa.
Yeah. Thank you, Dr. Naveen Malhotra, sir. As Dr. Yogen Bhatt, sir, and Dr. Manisha Katikar, madam, said, it is your leadership, your enthusiasm that is coming down to us, and we are gaining all the energy, and we would like to keep the ISA head at a highest position, which is your dream. Thank you very much. And can we conclude the session, sir?
We can conclude by loudly saying, long live ISA!
Long live ISA!
Long live ISA!
Long live ISA!
Long live ISA! Long live ISA!
Jai Hind!
Jai Hind!
Thank you.
Jai Hind!
Thank you, sir.